All right, on my clock here, we have 1:01. Again, this is Tim Mulvihill with IHC. Thank you for joining us this afternoon. On the phone with me, I have Tony Burlow, Regional Sales Manager, Individual Markets. I'm Vice President of Sales for IHC. I want to thank you for joining us this afternoon. We're going to be speaking a little bit about our short-term medical products, a suite of ACA carriers that we have to offer, and the platform that we have to make your life a little bit easier. Tony, would you mind changing to the next slide for me? Thank you. So for this afternoon, this is our agenda. We will be talking a little bit about the IHC group as a little introduction for you. We're going to talk about why Kemper chose to work with IHC. We're also going to talk about short-term medical and ACA, do a little bit of compare and contrast to help you understand the opportunity in the marketplace. We're going to talk about our short-term medical plan called the Connect series, and Tony's going to give you an overview of the product. After that, Tony's going to give you a demonstration of how to quote and enroll our short-term medical products. He'll show you the back office a little bit so you know how to manage the business when you write business with us. He's also going to walk you through the ACA quoting and enrollment process. As we go through it, each section, we're going to stop for a little bit of question and answer session in there. So we'll break things up a little bit because we do have so many people on the line. We'd appreciate it if you hold your questions until we get to each of those Q&A sessions at the end of each section. Tony, would you mind going to the next slide, please? Thank you. A little bit about IHC, the Independence Holding Company. IHC is publicly traded on the New York Stock Exchange. We're about $570 million in capitalization. We're made up of three wholly owned insurance companies, all of which are A- rated by AM Best. And we're in multiple segments in both health and accident, group and individual products. And throughout that, we're in many aspects of the industry. Tony, would you mind going to the next one, please? So why did Kemper choose IHC and IBG to partner with? Mainly because we're going to help you grow your business. We're going to be offering you a comprehensive product suite that's going to include both short-term medical and various ACA carriers. We're going to be providing you with dedicated agent support. And then we're providing you with a platform that makes enrolling and quoting all these products both easy and makes it so that you can provide the most suitable coverage for your client. And I want to ask Josh or Roger, do you want to make any further comments on why you chose to work with IHC? I'm guessing they're on mute right now, so I'll just go ahead and continue on. Tony, would you go to the next slide, please? So you're going to have access to a short-term medical plan that has comprehensive rates, multiple deductibles and co-insurance. And I'm sorry, someone seems like they're not on mute. We're getting a lot of feedback. Everyone be on mute, please. Thank you. The short-term medical with comprehensive rates, multiple deductibles and co-insurance, and out-of-pocket choices. We're going to be providing you with simplified medical underwriting, no network restrictions. One of the plans even offers up to $25,000 in pre-existing coverage, and the short-term can be written all year long. Next slide, please. Tony, can you go to the next slide, please? Thank you. So ACA opportunity that we're going to be providing you with access to multiple carriers and networks. the ability to calculate subsidies for your customer, and then also access to all the metallic tiers. Next slide, please. So side by side, ACA and short term. ACA offers a permanent plan for your customer. It covers pre-X, it's subsidy eligible, guarantee issue, but is only available during open enrollment period or special enrollment periods. And it can also be expensive. On the other side of the ledger, short-term medical, while it's temporary, it only covers up to 36 months of coverage for your customer at a time. Pre-X generally is not covered under short-term medical. No subsidies are eligible with short-term medical plans. These plans are underwritten, so not everyone's going to qualify for them, but they are available for enrollment all year long, and they offer a lower premium to your customer typically. So I'm going to hand it off to Tony now. Tony's going to go into a little bit more depth on our short-term medical plan. Tony?
Thank you, Tim. Real quick housekeeping. Just want to let you know there is a slight delay, so I'll do my best to manage the screens as they transition over. So thanks, Tim. We're going to spend a little time here and talk about our short-term medical Connect series from IHC. So again, first thing that we've got up on the screen is going to be our national footprint map. Obviously, you are very specifically focused on Oklahoma and Texas, but we just wanted to demonstrate that we do have a nice broad national footprint and a very recognizable product nationally in the short-term medical space. So we just wanted to share that in the map. This next slide, we wanted to just touch upon a couple of things regarding short-term medical. I always like to start off with the cons and then provide solutions and some of the pros that are associated with the short-term medical from IAC. So first bullet we've got up is short-term medical does not provide coverage for all of those ACA essential health benefits. Keep in mind that short-term medical is a much different product. It does not cover routine maternity care or behavioral health services. And then depending on the short-term medical plan that you select from us, most likely the pre-existing conditions are not going to be covered on there. Short-term medical insurance is not qualifying health coverage or minimal essential coverage, so it will not satisfy those requirements of the ACA. And of course, short-term medical coverage is definitely limited in its duration. You've got the ability to select a very defined time frame on the short-term medical plans, but keep in mind that it is not ongoing. It will have to be renewed and reapplied for. So those are some of the cons of the short-term medical coverage. Let's talk about some of the pros. So, one of the big highlights of short-term medical is it is extremely affordable and a lot of times will make sense for a customer, compared to the ACA. But keep in mind that it provides less benefits than an ACA plan might cover. It also is a plan that needs to be medically underwritten, so you have to qualify through our underwriting questions to provide short-term medical coverage. Okay. The great part about short-term medical is that these options are very customizable. We've got a number of different deductibles and co-insurance to help, kind of tie in with what your needs are with your customer. So again, we'll talk about those in just a little bit. One of the big benefits of our short-term medical plans is that healthcare services can be received from any healthcare hospital, doctor, or provider. And of course, one of the top benefits that we find in the short-term medical space is that there is no defined open enrollment period with short-term medical. So again, short-term medical is available for purchase year-round with next day effective dates available as well. So it's very easy to access year-round. That's one of the big benefits of short-term medical. Now, as we talk about our short-term medical plans here, we offer two different plan designs. One is going to be the Connect STM, and the other one is going to be what we call our Connect Plus. The big difference between these two plans really is going to be that the Connect Plus is going to provide up to $25,000 of eligible expenses related to pre-existing condition. So as we know, short-term medical typically does not cover pre-X, and our Connect Plus is one of the only products in the market in the short-term medical space that offers this kind of coverage with that $25,000 of eligible pre-X coverage. So it's a very big differentiator in the marketplace, and it's a great product as people are looking for alternatives to transition over from an ACA plan. So let's talk about some of the planned options that we offer in our short-term medical suite. So as we mentioned before, there's quite a few deductible options and co-insurance options that we offer for you. So this is very good because you can kind of build that plan design to fit the needs and budget of your customers. So you'll see on our Connect short-term medical plan on the left-hand side, we've got anywhere from $2,500 up to $10,000 deductibles, along with several different co-insurance out-of-pocket options as well. On the Connect Plus side, which is going to be the column on the right, we're going to offer $5,000 and $10,000 deductibles, along with several different co-insurance options as well in that space. Now, again, I'm going to reiterate the fact that the Connect Plus is the one that's going to provide right down here up to $25,000 in pre-existing condition coverages. These are $2 million maximum benefit policies, which is another big differentiator in this space for short-term medical. So again, you can feel confident that you've got adequate protection for those customers in this space. So again, lots of different combinations in which we can build these products and plans to suit your needs of your customers. On this screen, this basically is going to give you a couple of different things. So on both of our Connect short-term medical plans and our Connect Plus, you've got the ability to choose either an office visit copay or an outpatient prescription drug option. We see that quite a few of our agents are choosing to go with the office visit option. But again, a big differentiator in this market, having an outpatient true prescription drug benefit is fantastic. There is a $2,500 deductible that's layered in on that outpatient drug benefit. But again, it gives you some real nice flexibility to kind of choose the benefit that might suit your customer best. I also like to point out that the prescription drug benefit is not subject to pre-X condition limitations. So again, that could be a definite benefit for your customers. So again, we'll talk about this a little bit more as we get into the quoting. But again, you've got the ability to choose an office visit copay or an outpatient prescription drug benefit on either the Connect short-term medical or the Connect Plus. Okay. Some of the other covered expenses, I'm not going to go through these line by line. You'll see, for example, on the air ambulance, there's a $1,000 per occurrence benefit there. When you start looking at the outpatient surgical or ambulatory surgical center, those are going to go towards deductible and co-insurance. There's no restrictions on daily benefits there. But again, just wanted to give you a snapshot of some of the additional covered expenses. Another thing I like to point out is the last bullet point here when we talk about mammographies and pap smears and prostate specific antigen tests. That is going to go directly into the co-insurance. So that's always a nice value for your customers. So keep in mind when you're quoting out the plans, there will be no deductible to be waived into the co-insurance. And of course, that will vary by state, but I always like to point that out. Okay, one of the big things that I really want to make sure we're all aware of here is in the short-term medical space, there are pre-existing condition limitations. So for example, on the standard Connect short-term medical, the pre-existing condition is going to be defined as it is below. So we're going to have a 5-year look back. So any sort of treatment or medication or consultation that has been received for a particular condition within the past 5 years is going to be classified as a pre-X condition. So I always like to make that very clear that in the short-term medical space, there are pre-existing condition limitations, unlike the ACA that does not have those. Now, again, I'll reiterate that the Connect Plus plans do have a $25,000 benefit there for those covered expenses in the pre-X space. But we want you to be very aware that in the short-term medical space, it is definitely a different tactic here compared to the ACA. There are pre-X condition limitations on there. Okay, so we just wanted to reiterate that fact to make sure that everybody was aware. Okay. From an eligibility standpoint for short-term medical, we've got this available to the primary applicant and spouse, anywhere from age 18 to 64, and of course their dependent children under the age of 26. We do offer and have the ability to issue a child-only plan, but the children must be between the ages of 2 to 18 in order to be on a standalone policy like that. They also must be a United States resident, lawfully authorized to live permanently without or within and currently residing in the United States. So again, we just wanted to give you a snapshot of the eligibility there. So again, we can do the child-only policies and customers anywhere from 18 to age 64. Oh, okay. So what I'm going to do now here is I'm actually going to do a live demonstration because I think this will help give you a little bit better idea of the product and the process. So I'm going to go ahead and jump over to this screen here. And this is going to be the producer portal here where you'll be doing your quoting and enrollment for the short-term medical plans. So a couple things here. This is going to be the primary home screen when you log into the agent portal. When you first log in, you will see the map there that'll give any of your current licenses on that map. Couple other things I want to touch on before I get into the quoting and enrollment process. So you're going to have some tabs up here. One of them that you're going to have is going to be called My Book. When you go into My Book, this is going to give you the ability to go in and look at any current clients that you have and review their case statuses. Under case status is where you're going to be able to pull up a customer. And there's a number of features in which you can sort and pull these customers up. When you pull them up, this is where you could go and potentially pull up a temporary ID card, find any information around the termination criteria or effective dates of the policy. So I just want to make you aware that this is where you're going to have access to your customer database. There's also going to be lapse cases, and if anybody's pending a late payment, you can also pull that up via the back end under My Book here, okay? And all of your quoting activity for your individual policies will also be displayed here. One other tab I wanted to hit on real quick is anytime you need materials for any of our short-term medical plans, you can simply go into the Download Materials tab here and pull up current brochures for our short-term medical plans. So I just like to point that out if you ever need to access brochures. There are quite a few places on the portal in which you can access these, but again, I just want to make sure you knew where those were. Okay, so if we go back to our Home tab, you're going to notice that there's going to be a little brown box below here that says Quote and Enroll Now. So if you click that button, you're going to pull up two different tiles, and you're going to have one tile that is going to be specific for the short-term medical insurance, and the other one is going to be for the INSX Cloud or our ACA enrollment, which we're going to touch on in a little bit here. Okay, so again, under the short-term medical box, you're going to notice there are download forms here. So this is another pathway in which you can access and download those short-term medical forms. But for our illustration, we're just going to click the new quote. And what's going to happen here is it's going to pop open a new window tab, and this is going to be pretty standard demographic information that we're going to collect in order to run this proposal. So I'm going to use 75205. We'll pop in that zip code. It's going to ask you to verify the coverage start date here, okay? Notice it'll default to next day coverage effective dates, so you can get coverage as early as tomorrow. But again, if you click the map, it'll give you the guidance around the effective dates that you have and can select, okay? So here we go. We're going to verify our start dates. We'll enter our general demographic information in here. I'll just use myself. It's going to request and ask you if they use tobacco or not in the past 12 months. I'm going to select no. And then we'll add in a spouse. So just under that plus sign, you can go ahead and pop in and add a spouse. And if you had to add any additional dependents, you would just simply do that by hitting Add a Child. So once you enter that demographic information in, you're going to hit See Quotes. And this is really a cool functionality piece here, in my opinion, on this platform. Something that we offer is going to be Cover Me to open enrollment. So once you enter that demographic information, you'll have the ability to choose your monthly payment options, or you can do a single pay up to 6 months. And then it'll also ask you how long would you like that coverage to last. So if you want to do a 364-day policy, 6 months or less, or if we're in a particular state where it's got extensions, you can go more than 364 days. But we have got this tab here that's really just a great tool. So we can simply click this button here that says Get Coverage until January 1st of 2021. So if you've got a customer that has no coverage as of today, and we're looking to just get them to the end of the year, this will calculate out a very specific timeline and get them all the way till January 1st, and could potentially save them a few dollars from having to get into canceling policies or not, we're all trying to get this all in a line, January 1 to January 1. So again, a very effective tool that we got there that you can utilize to get your customers covered to January of 2021, okay? Now again, certain states you'll notice we can go out to 2022, I'm sorry. So again, we've got those tabs that make it very easy for you to kind of align your customers with the January 1st effective dates. So for this illustration, that's what I'm going to do. I'm just going to select Cover Me until January 1st of 2021. I'm going to hit See Policies. And basically these plans are going to come up based on my criteria that I entered. So you're going to notice in this box here, it's going to give us the indication that the policy duration we're quoting is to cover me until 2021. And you'll have a number of different features in which you can set in and look at. So you can look at very specific deductibles, co-insurance, policy durations, and policies. So you have some ability to sort and filter up top there. You'll have just the Connect STM plan name, or if it's the Plus, you'll notice that down below it'll indicate that it is a Connect Plus policy. So this is a Connect Plus here. And the big difference, of course, is going to be in the Connect Plus, we've got that 25K of pre-X built into that Connect Plus plan. Okay, so I'm going to scroll back to the top. So the first policy that comes up, we're going to have deductible information, co-insurance, out-of-pocket. Of course, it's a $2 million max benefit. It'll give you any indication if that pre-X is in there. And then outpatient prescription drugs are not covered because, remember, I said there's two different options, and this is going to be OV, which is going to be the indicator for the office visit benefit. Now, this same plan with the same deductibles is going to be right below it here, but it's going to be indicated with the RX tab on the bottom. So again, when you see the outpatient prescription drugs, it'll give that information here around that outpatient benefit for the prescription drugs. Okay, so that's how you'll know if it's an office visit option or the outpatient prescription drugs. Okay. Now you also have the ability to click on the Details tab. If you'd like a little bit better snapshot of that plan design, you can simply click on that and it'll give you a layout of all the benefits in there as well as the brochure and exclusions and limitations. Okay, so back to this original screen. If by chance my customer liked this particular plan design that we're looking at, we can do a couple of things. We can either click the email button and you've got the ability to email this directly to a customer so that they could apply on their end and it would all be tracked and traced to your own producer number. Okay, so that is one option. Or if we've got the customer on the phone and we want to go with this plan design, we can simply hit the select button. And when we hit the select button, it'll prompt me and give me a couple different options again. It'll give me the same prompt to email this particular quote directly to a customer for them to apply. Or I can go in here and simply hit this begin application. If I hit the begin application, remember short-term medical is a very efficient application process. It is not an extensive application. It's very quick and short and sweet. Now, if we hit begin application, it's going to ask us a couple of different things. Is the applicant in person or are they on the phone? I'm going to demonstrate the on the phone option because I have a feeling you might be with the COVID situation talking on the phone more. If we select on the phone, I want to point out a couple of things. They're going to ask how the applicant would like to receive verification, because we do a slight verification process for the customers to verify their information and health responses are all accurate, which is a great feature. It's not a very time-consuming process, and it helps protect you as the agent by allowing them to verify those health responses being accurate. So they've got a couple options. You can either email it to them, or we can do a text verification. All this verification does is send the health questions over to them in the application so that they can look through those and verify from their end that the health responses indeed are accurate, and that they're willing to accept the electronic records via email. So it's a very quick process. There's about 5 health questions that are yes or no questions. So again, these applications are very, very easy to get done, and they take maybe 5 minutes, 10 minutes max to get these applications done. Okay, so I just wanted to demonstrate that. I'm not going to go through the entire application, but I did want to show you that you have the ability to do these verifications here for your customers. Okay. Okay. So I'm going to stop just for a minute because we kind of went through the short-term medical on a very high level. I want to stop and see if there are any questions that we currently have as of right now specific to short-term medical before I get into the ACA aspect. And you can either type it into
Tony,
the... Oh. Go ahead, Tim.
Okay, I saw on the verification you had both email, text, and phone. Do you have any that you recommend?
You know, my personal preference is going to be, I really like the text verification, just because if you're on the telephone with a customer and you've got their attention at that particular moment, you can simply say, hey, do you have your...
Muted. Unmuted. Muted. Unmuted.
Okay. I recommend the text feature because when you have a customer live on the phone with you that you have their attention, you can simply say, hey, listen, I'm going to send you a text. And once you hit the button, it literally will go ahead and shoot that text verification to them while you have them on the phone, at which time you can say, hey, here's the instructions. I want you to click this link, open this up, and verify it while we're on the phone so you don't lose tabs on the customer. We know what happens sometimes if we don't get a verification done right away. It can drag on for quite some time. So again, I think the text feature is phenomenal when you have a customer on the phone like that, just because of how fast you can get it done, and it doesn't get lost into email space. So that's my recommendation.
You have all lines on mute right now. Do you want to see if there's any other questions?
Sure. I'm going to go ahead and unmute some of the folks here. Looks like there's some questions. Just keep in mind if you got any background noise here. But I'm going to go ahead and unmute some of the participants here because I'm getting some messages. Does anybody have any questions specific to short-term medical? I've unmuted quite a few of you. It looks like most of them. You can also type it into the chat feature. We do have one. It says, is there a plan that has RX and the office visit? Great question. Unfortunately, at this point, we require you to choose one or the other. So at this point, they would either have to make a decision around if they would like the outpatient prescriptions or if they would like that office visit. Okay. Yeah, so if you have any other questions, like I said, you can always go ahead and type it into the chat feature as well. I have unmuted almost everybody, it looks like, so you can attempt to ask, or if you'd like to type it in the chat feature, that's fine as well. Okay. Okay. Any other questions regarding short-term medical at this point? No? Okay, we'll circle back and have another Q&A session. So I'm going to go ahead and just move forward with the ACA to kind of keep us on our time schedule. So what I'd like to do is we're back at this quoting screen, and again, I really want to demonstrate another really cool tool, in my opinion, here on the platform in regards to short-term medical and the ACA. So when we're here and we're looking at our quoting options that we were just looking at for the Connect short-term medical, there's going to be a tab up top here. You'll notice one says short-term medical, the other one says ACA. So if I click on this ACA tab, one of the really neat things that this does is it's automatically going to default and pull that customer information that I was just quoting over into our INSX cloud platform for ACA quoting. So again, from a time-saving perspective, it's a really cool tool. If you're trying to have a conversation with a customer to determine if ACA makes sense or the short-term medical makes sense, you'll have the ability to click that tab and it'll slide right over into the ACA quoting platform on INSX Cloud. And like I said before, it also will pull over the customer's data, so you can already see my date of birth is already loaded in here, just like we did on the short-term medical. Okay, so this is going to be the primary quoting screen for the ACA. Your default producer name will be up top here. You're going to have basic information as far as the zip code. If there's going to be multiple counties in a particular zip code, you'll see that on this drop down here, okay? And then you're going to choose the effective date. So now, just so you know, we do have our 1/1 rates out there, but I'm just going to quote a December plan because I want to demonstrate a couple of different functionality pieces here on the platform. So once you get the zip code and you have all of your demographic information entered into the screen here, on this platform, you can also hit the plus button and add an additional dependent in there if need be. But we're going to put in our basic demographic information, and once that's in there, we're just going to hit the next button, okay? And when we hit the next button, it's just going to basically say we're showing the ACA plan options here, which is going to be this medical tab. And we've got our premium estimator, subsidy estimator built into the platform here. This subsidy estimator is actually tied into the back end of healthcare.gov. So it's a very accurate subsidy estimator. So once we get to the lines of coverage, we're just going to hit that next button. And what's going to happen is it's going to then bring up that subsidy calculator based on the information that was entered here. So you'll notice the zip code is going to be grayed out, the county is grayed out. All it's going to require is for us to enter in our household income. So you enter in the household income. The next drop down that you do have the ability to change is, although we're maybe only quoting 2 people on this particular quote, you might have to update the household size because there may be more family members in that particular household, so you can do so on this drop down. So again, you're going to enter the household income, you're going to verify the people in the household, and then the other tab that's on the lower portion here is, of course, one of the questions regarding ACA is, do these customers have access to affordable employer medical coverage? This is a very cool tool, in my opinion, because when I was selling directly with customers, I'd say, well, do you have access to an employer medical plan? They might say, yes, my husband has it, but it's extremely expensive. Well, one of the things that we've provided for you here as a tool is we've got an affordability calculator. So you can click here and actually enter the information and the criteria for that particular customer to determine if their employer medical coverage is actually affordable, okay? Because it cannot be any more than 9.5 of the annual household income. So this is just a great tool to help provide for you and help answer those questions, okay? But in this illustration, we've got our household income enter, the household size. They don't have access to an employer plan. We're going to just hit this calculate button. And you're going to notice what's coming up here is they are at 394% of the FPL, which means that this particular customer is going to qualify for a $432.33 subsidy. Again, this is an estimate until we actually complete the entire enrollment and verify all the information. But again, we know that they're qualifying for some sort of a subsidy. So once we get to this point, we're just going to hit that next button. And what's going to come up here on our next screen is it's going to bring up all the different ACA plans that you all are offering in all the respected markets. So again, I used a Dallas zip code for this illustration. Now what comes up, you're going to notice a couple things. There's actually 59 medical plans that are available in this particular zip code, okay? Your agent information will all be embedded here based on your national producer number. And then we've got a couple of different tabs here that you can apply filters. So if there's a particular carrier you're looking for, you can simply filter that out by insurance companies. You can get into metallic tier filters. So again, there are some filters in which you can search and kind of narrow your results down if that's something that you would like to do. It always is going to default from
Hey, Tony,
yeah.
Just quick comment. What you're showing right now are 2020. We're able to now preview the 2021 rates. Looking at the carriers that we're going to be able to offer, which are Oscar, Bright Health, Friday Health, Ambetter, Blue Cross of Oklahoma, and Blue Cross of Texas. One in particular is really standing out looking at the 2021 rates, which is Friday Health in the zip code that you're in right now, which is Dallas. It looks like they're going to have the lowest rates in Dallas pretty much across the board. At the same time, they're offering the highest commission that we've seen so far at $22 per member per month, which is extremely good. So once you start quoting the 2021 rates, you'll see that what's lowest and what's most competitive actually changes a little bit, and Friday Health is going to be one that really stands out in Texas.
Great point. Yeah, and like Tim said, the 2021 rates are available. The only reason I selected a December plan effective date is so I can show some of the functionality, because the 2021 rates, of course, cannot be selected at this particular time until open enrollment. Okay, so once these plan designs come up, you're going to notice a couple things. It'll give you carrier name on the top right here. You're going to have an indicator as far as the metallic level. So this is a bronze plan. You're going to get the plan name. So this is going to be the Core Care Bronze 2. This is an on-exchange plan. And then you're also going to see the plan type. So it'll give you an indicator if this is an HMO, an EPO. So it'll give you just a high-level overview of the plan designs and offering. You'll see on the quick view, you've got deductibles, coinsurance, any primary care visits or generic drugs. And then there's just a ton of other information in here. So first off, on the monthly cost, it'll give our price breakout. It is going to factor in that monthly subsidy that we calculated. So the estimated total is going to be reflective of that subsidy being taken into account, okay? But there's just a ton of information. So if you're getting questions by your customers, you've got a lot of tools here. Under the summary tab, this will go into a little bit higher level overview of the plan designs and benefits. One of the big topics in the ACA, especially when we know we're dealing with an HMO, is my doctor within network. So you've got a provider lookup tab specific to this particular plan design where you can verify the providers, prescription drug lookups. And then you've also got plan details, which under the plan details, this is going to be provide you the summary of benefits. So it's a very detailed breakout of the entire plan. So if someone, for example, says, how's mental health covered on this particular plan? You could go under this plan details and reference exactly how the mental health would be treated and covered on this particular plan design. Okay, so you've got a lot of information here that you can leverage regarding these plan designs. One other thing I want to hit on here is we've got to compare this plan tool. So if you select this box right here, you can go and select anywhere up to 12 different ACA plans on this compare feature, and then you hit this compare button here. And when you hit this compare button, it's going to pull up a very nice PDF of the selected plans. We get a lot of positive feedback on this, actually. So your broker information will be on the top right, your customer's information will be on the top left, and then it's going to give a nice spreadsheet breakout of all the selected plans and do a nice comparison for you so you can share that with your customers. Okay? All right. But let's just say in this illustration, we wanted to go with this Core Care Bronze. We're just simply going to hit select this plan. And when we hit select this plan, it's basically going to pop up and say, hey, are these the 2 subscribers that are going to be on the policy? Yes. So we're going to hit save and next. And now it's going to get into our summary screen. So it's just going to basically, do a quick high-level summary. Here's the Core Care Bronze that you selected for your customers, the estimated subsidy amount. And now this is where you've got a couple different options and pathways in which you can move forward. If you'd like, you can just simply, if you got them on the phone or you're sitting there with your customer, if you just hit this start application, it's basically going to get you in and walk you through that process, at which time you can get this ACA policy submitted and you'll be all good to go. So you can agent assist and do this enrollment right here by hitting start application, okay? The other option you do have is if you click this invite applicant, it's going to pop up and give you an email template so that you can send this particular quote directly to your customer for them to quote go through the enrollment on their end, and it's all embedded to your national producer number. You can go in here and customize the body of this email. So you could go in here and say, hey, if you have any issues, please contact me once I get the application. You can type in whatever you would like and make that very personal and specific to your needs and your customers. But again, I always like to point out you've got these 2 options. You can agent assist and do the enrollment right here by hitting start application, or we can do the invite applicant and go ahead and send that directly to them, at which time it's always going to be embedded with your national producer number. Okay? You've also got calculators and all sorts of good tools here on the left side, but I know we don't have a ton of time. But again, I wanted to go through that quoting process. So let me stop there just for a second. Any questions regarding the ACA aspect? Anybody have any questions about the ACA? No?
I got a quick question on the short-term medical.
Sure.
I noticed that you had a $10,000 deductible and a max out-of-pocket of $10,000 with a co-insurance of 50%.
Correct. Great question.
So does that max out-of-pocket kick in after the deductible?
Correct. So the deductible would be satisfied at $10,000, at which time we'd pick up 50% after that until the customer reached another $10,000 out of pocket. Great question.
Thank you.
You bet. Any other questions? Okay, I'm going to bounce back to the slides. We'll have one more opportunity for questions here, but again, we'll let's see. Okay, Tim, do you want to take this? You want to talk about this, or would you like me to?
No, I'll go ahead. So earlier in the discussion, we had talked about having dedicated support for Kemper agents. We have one gentleman by the name of Jeff Lahman, who's been in the industry for quite some time, been working with IHC for several years now. He is designated to be able to take your questions. Now, Jeff is very knowledgeable pretty much in all subjects of short-term medical, also ACA, but he also has the ability to go to anybody within IHC to be able to get any support that he needs, whether it be technical support or very specific on a policy or service. So the phone number that you see there, this will be given out to everybody. You're going to be able to call that number, and that's the only number that you'll really need. Jeff's going to be able to take any questions and be able to help you out with anything, whether it's sales related, you're with a customer and you need some help, or it's service related. He's designated to support everything that you need. Would you mind going to the next slide, Tony?
Yep.
Additionally, along with Jeff's designated support, The one here that's in the middle, these three options, the technical support, that's also available to you. The technical support is going to be anything that involves the enrollment process, particularly ACA. You're going to be able to call that number if for any reason Jeff isn't available or you just simply have a technical issue. They can back you up there as well. Again, we'll be providing you with all this contact information, but just want to make sure everybody knew that we'll be designating one person to be your representative on the IHC side of things. Josh or Roger, do you have any comments? I know we had you on mute before. Is there anything that you wanted to add to what we've talked about so far?
Can you guys hear me?
Yep.
Yes.
Just a point of clarification on the Blue Cross Blue Shield right there. It's still going to be under the old contract that Somerset and Kemper Health have with those directly, but the agents that have those contracts could sell it through this platform and still get paid like they do today. So just wanted to call that out because it was kind of a change from when we originally set this up.
So at the point of quote and enrollment, you will see all the carriers that are available, including Blue Cross. You won't see any difference as far as the process, but that is not a contract that's brought through IHC.
Right.
So one other thing I wanted to make mention of, just so you know, in Oklahoma and Texas, we do have extended durations for the short-term medical. So you will see those options out there as far as being able to offer more than 1 year time frames. So you will see that in that quoting box when it comes up. You will have those options available in those two states. And I believe
So any other questions while we're here this afternoon?
Pretty easy bunch, I guess. Tim and Tony.
I was going to say, and of course, we're recording the presentation, so we'll make sure that we get that over to you guys. We're recording it for you. So,
well, thank you very much for your time.
Appreciate the info.
Josh, thank you.
You as well. Yeah, thank you guys. And if we have questions, we'll follow up.
Sounds good.
Have a good afternoon, everyone. Thank you.